Well, tell me about this bunion. How's it giving you trouble?
Well, it rubs against my shoes mostly. And when I walk, sometimes it's painful and sometimes it's not. Depends on the shoes I wear. That's the biggest problem I have.
With the rubbing, I'm sure.
Rubbing on my shoes.
So we got the patient all scrubbed, prepped, and draped, and you'll see a couple lines on the foot, but what I'm going to be doing is just making a small little poke incision here where this little X is, a small little poke hole incision here where this little line is, and a small little poke hole incision right here on this side of the toe. And what you're going to notice once we're done with everything is that bump that's right there. That's the bunion bump. That's going to be gone. On the x-ray, you can see that that big toe is tilting and hitting the adjacent second toe. So after surgery, you're going to see me taking a wedge of bone out of that toe. That's going to allow me to pull the big toe off of the second toe. So we are now 6 weeks out. This patient had the Emerald Bunion Transformation on this foot here. And you can tell that we took off the bump and then we made a wedge cut in the bone to essentially hinge the toe off of the second toe. What was the surgery process like for you? Can you kind of walk us through that?
Well, yes, I can. I mean, it was absolutely simple. I mean, once you did the surgery, a week later, it was virtually painless. I had no problems at all. If you're having bunion pain, do it. That's well worth it. It is well worth it because it's painless and it's only 6 weeks.
Well, thank you so much for sharing your experience.
Sure.